Strong Toyota, leading the way every day. And strong Toyota, symbols of trust.
I'm here to proudly announce to you that, and the people of Guam, that GMH has been fully reaccredited for the Joint Commission for the next 3 years. This is really a tribute to the hospital's efforts to continue moving the hospital forward and providing the best, safest care that we can.
GMH Administrator Joseph Verga made the announcement this morning, flanked by Acting Governor Ray Tenorio, Acting Health Committee Chair Senator Aline Yamashita, Medical Director Dr. Larry Lizama, and Medical Staff President Dr. John Sidell. They all hailed this reaccreditation as a sign of change for the better at GMH.
It's no small undertaking to change the culture of an institution over a 3 to 4 year period, and I think this JCO approval shows that the tremendous cultural change at GMH amongst the nurses, amongst the ancillary services, amongst the administration.
This entire island needs this hospital and the confidence of the people placed in it, because we don't need to go off island unless we have to go off island. And the more we're able to use the services of professionals, whether it be nurses or doctors or other clinicians that are here in this institution, the more it benefits our community, the more it benefits our island.
There's still more work to be done so that we can all feel comfortable about getting our care here, but certainly this is one step in that process, and the accomplishment is a great accomplishment for GMH, for Guam, and the people of Guam.
GMH only regained accreditation in 2010 after years of being without it. The Joint Commission's decision to grant reaccreditation now follows an inspection of the hospital in April, which cited a number of issues which had to be addressed in a plan of correction submitted by the hospital. At that time, Verga told us that the Joint Commission had concerns about the lack of adequate financial resources which might impact patient care, the challenge to the peer review process posed by the settlement with Dr. George Macris, as well as issues with the way the hospital handled pain management and the inspection of its fire prevention systems.
There were 7 or 8 issues that we submitted plan of correction that they accept, and then every 4 months we submit measures to them, measures of success, which they then monitor. So they accepted our plan, and our plan submitted to them details what we have done and what we will continue to do. So they will continue to monitor us.
The reaccreditation follows the enactment of Public Law 60, which taxes gaming machine revenues to provide funding for an urgent care facility and ongoing expenses at the hospital, as well as Public Law 43, which expands the borrowing capacity of GMH.
Seeing a series of real actions and commitments from the government to get the hospital additional resources certainly went a long way in showing them that the government and all of us are serious about improving the hospital and making sure the hospital has the resources it needs.
However, Verga also acknowledged that more work needs to be done.
We are not out of the woods, and we're not done by any stretch of the imagination, but the people of Guam could rightly be proud of their hospital, and we have been fully reaccredited for another full 3 years. It doesn't mean that they can't come back and they can't do a spot check and all of that, and they certainly will, and we certainly welcome that because we are survey ready all the time.
Kevin Carey,
This is the way we
PNC
operate
News.
every